until it finds the thing.
Click.
Yeah.
Okay.
And unscrew. This goes into a bag to sterilize, and you wipe it and you put it. That's it.
Okay.
Turn off.
Okay.
That's pretty easy. This one has to have the, but it's also streamlined. It has to have the bag. That's for implants. Okay, so it's an actual motor.
Okay, so this one's for implants. This one's for scaling.
Scaling. Yeah.
Okay.
And I may be using both in the same procedure
Okay.
also, but yeah, that's you just slide in the. So this goes up and down,
Okay.
and we slide in the tube, and then we hang the bag, and
Okay.
we have to make sure it's not running yet. So for example, this are the bag. They came with the unit, but this part that has the punch stuff goes up and into the bag.
Spike it.
Yeah, you spike the bag, exactly. This locks in so that it doesn't run like this when it pinches on the thing. So we want to make sure that it's like that in the beginning.
Sounds like an IV bag.
Exactly, yeah.
Okay.
And the other end goes here, and we lock it. And then the end goes into the handpiece, so that it irrigates what I'm doing, which the handpiece was here. So it will get into this tube, and it gets my water here.
Okay.
We'll obviously go over all of that, but just to get a sense of what it implies. Setting up for implants is probably the longest.
Yeah.
So we'll try to make like at least 20 minutes, if not 30 minutes, between patients
Okay.
when we have an implant. Unless we can use something else and have this set up in the morning when we know we have one, and that's another good option.
Yeah, so in an ideal world, we'll get to the point where we can look at your schedule, see what you've got, and the next patient will have everything set up and ready to go for you. Just,
Yeah, exactly. That would be the most efficient. And so yeah, these are that, and I have 3. They should be fine. Obviously we can use any of these. They're different. Some of them are duplicates. Some are finer. Some are, see, this is finer.
yeah, how does the sizing, is it by gauge or something, or just
G6 to G4.
Yeah, so it's like the diameter of the
G4, yeah.
whatever.
But it's basically G4s and 6, and I have an 8 here, which is mounted.
What are these actually called then?
These are,
What are
the scaling tips. I
Scaling
think.
tips, okay.
Yeah, or the piezo tips. This is a piezo scaler.
So this says non-sterile. Does it have to be sterilized before use then?
Yeah.
Yes,
So
everything,
we'll put
yeah.
this in the bags.
Okay.
But that's it. This only wipes with
Okay.
Cavi.
And we can only do 3 at a time then? Clean 3 at a time?
She said
Yeah,
only,
because we
yeah,
have
but
to-
only clean with Cavi, not sterilize them with the sterilizer.
this part.
Yes.
Them.
These
yeah.
need to be run
Yes.
through.
Those need
Yes.
to be run. As with all of the metal stuff, basically, like the hand pieces. So they go individually, obviously. I mean, we can put them in a kit, but actually, I think I only have 1 or 2 of these.
Okay.
So, yeah. What else? I mean, burr kits. It's gonna be easy because I bought kits, So I know that perio surgical instruments. If I want this other than what it's in one of the kits, we'll have them sterilized in a bag, and you bring the whole thing in. Not to worry about so much about individual burrs and stuff, trying to make it simple. And Brazzer is excellent, the company.
Are they?
Oh yeah, but so are the prices.
Yeah.
So,
You get what you pay for.
exactly, yeah. No, this is, a calibration kit if I need to adjust the bite for some reason, especially if it's something that I'm doing, or it's it traumatizes a tooth and it has now bone and gum problems. It's loose. I can, adjust, especially if I'm doing a procedure and it has to be stable. and maybe equilibrate with these burrs, and then maybe splint it at the same time, you know, with some flowable composite. That's why we need the light. But these are usually rare, and like this is not something I would do every day. And then I do the surgery, because if the tooth is moving, it's not going to regenerate well around the tooth. What I'm doing the bone graft and all that. So I have to make sure that I eliminate the cause for that movement, and I make it stable before.
Okay, sorry, just so I understand. So the the composite splints that you're creating, are they just temporary for stability?
Yeah, it
or
could be longer term. Yeah,
Long-
but they
okay.
are. Yeah.
Okay.
Mhm. And they're all extracoronal, so I'm just, you know, acid etching, and it's on the inside.
Okay.
It's like the retainer that orthodontists give to patients, like
Oh, gotcha.
forever.
Okay.
You know? So that it doesn't go back to the position that they were.
Okay.
Yeah. And yeah, but okay, bite blocks, you know, I have them in the. I'll have to see if this is too small. It looks like a small, but typically the too big or too big. I'm gonna have to see for our patients if they're good enough.
Are you gonna the services that you offer don't pediatric patients aren't gonna need what you offer, right? It's just mostly adults, right?
Yeah.
Okay.
Exactly. I'll have kids only if, you know, I'm extracting teeth for ortho purposes or something,
Okay.
like that, premolars,
Okay.
or a frenectomy or something. He seems to be doing many of these things himself,
Okay.
but others maybe some. Most of our patients are adults. You know.
Okay.
Mhm.